The World Antibiotic Awareness Week event was held at Steve Biko Academic Hospital Level 4 Auditorium, a significant world global health threat that occurs when microorganisms fail to respond to medicine. Dignitaries such as the CEO of the hospital, Dr. Majake, Professor Eminent, Professor Eminent, and many more, they shared insights about the critical nature of the topic.
We need to start learning how to use antibiotics responsibly. I think the main challenge we have is when we see a patient in front of us that are really ill, or maybe not that ill, is that we tend to sometimes irresponsibly prescribe antibiotics, and this impacts patients that need to come in years, because then we'll find that the same antibiotics we're using now will be not usable. So I think the ethics of all of this says consider everyone, consider the patient of now, and also consider the patients that come in the future, and start to use antibiotic responsibly. Otherwise we will not have any antibiotics left for the future. In the hospital we will have antimicrobial stewardship committees that will guide the use of antibiotics. And as I've stressed in the lecture, we need to really get management buy-in so that we can somehow make sure everybody follows these guidelines from the Antimicrobial Stewardship Committee in order to protect the antibiotics we will need for the future. Thank you very much.
Dr. Lu, senior of microbiologist, who is the organizer of the awareness event, shared insights about the importance of raising antibiotic awareness.
Okay, so this week marks World Antimicrobial Awareness Week, so it's a global effort and initiative that we've also now brought a bit closer to home. And essentially it's a week targeted at educational efforts and awareness towards antibiotics, antimicrobial stewardship efforts, prescribing, and not only in the human health sector, but One Health approach. So human health, agricultural, as well as animal fields as well. And the aim is really to guide appropriate antimicrobial prescribing so that we don't sit with a bigger problem later down the line of antimicrobial resistance and losing the last line antibiotics that we have available to us, which already is a massive problem currently. So it's a global effort aimed at minimizing this risk and progression going forward, and just really educating clinicians on appropriate antibiotic use and rational use thereof.
Dr. Annel Bosch also explains her presentation about her analysis and data capturing for Steve Biko Academic Hospital.
Yes, my presentation was looking at what we call the cumulative antibiogram, so it looks at the resistance patterns in the hospital. So I think this presentation just highlighted that what we already know, that antimicrobial resistance is a very big issue, and it's not something that's out there, it's something that's within our facility, and that we will have to put together our heads and come up with strategies and solutions on how we are going to combat this. So I think that is the purpose of this week across the globe, to highlight these very real issues that we are facing, and I think my presentation just substantiated what we already know. It just gave the hard data that nobody can refute. So I think if we have that, then that's a good starting point and to look to the future on how we're going to combat this issue.
Mr. Koketso Rosine pointed out his purpose as the sponsor of the event, invited for the awareness.
So yeah, thanks for the opportunity. Look, for us as Biko, we are in the metro diagnostic space, and actually we are a family-owned business. And part of our founders' key priorities is really, going beyond just having a passion regarding antimicrobial use. So usually what we do is every time there is some form of antimicrobial stewardship initiative, we want to get involved because it comes from our founder and it trickles down to us all over the world. So when we really start to partner, it's not just providing diagnostic solutions, really helping the likes of your area-based communities and those really on the ground and empowering them with the right tools to actually reach their goals. So we are not just a diagnostic partner, but we're also, I would say, a partner that wants to be heavily involved in empowering those who are involved on the ground by doing our bit to not just spread the awareness, but also come up with actual tangible solutions that can actually be used, particularly in South public health. The last bit also is that some of the highlights that did come out is, when you're looking at some of the data that's been presented, it does show that there's a strong need for us to do more. And starting the job doesn't mean that it should start at the hospital or in the lab, but it also means you and I have a role to play as well. Let's be cognizant of the prescriptions that we take. Let's not demand of healthcare professionals to always give us treatment that we would prefer, but rely on their expertise to actually prescribe to us and for us to follow the prescription to the letter in terms of what would actually work, not just for yourself as a patient, but also for your community, because anything that you do outside in your home does have an impact on those around you as well.
The gathering reminded us that working together is the key to protecting patients and keeping antibiotics effective for the future. I am Steve Biko for SBAH Radio.